Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine in one of the large medical schools. Now today is a big topic. We're going to look at the scientific studies and we're going to look at the effect of scalp massage on the stress hormone, and does it help or it will not help, or does it help? That's a big question. Okay. Now this study, let's look at, first I want to look at the study. This was published in the Journal of Physical Therapy Science, the effect of scalp massage on stress hormone, blood pressure, and heart rate of healthy females. In Hong Kim, PhD, is the primary author, and then you have Dr. Ko as the senior author on this paper. Now, let's look into this paper, see if it is going to be helpful to you or me. Okay, now, when you look at the stress, a lot of people are under a lot of stress. Every day, I don't know, everyone is like, the thing the humans face through every day in life is tremendous, right? If you work, a lot of stress. When you go home, there is a lot of stress. When you drive, there is a stress. We live in the world, the 360 degrees attacked by stress, right? So what does it do to our body? The damage, initially we don't think, but over the years, it can add it up, my friend, okay? So especially in this study, they looked at the females. Females are under a lot of stress, I think, because they play a very important role in the family life. They take, right now maybe it's changing, but, if you look at the kids and all that, who they look up to, their mom, and so the role, then they have to work in today's world because in today's world, you need financial to be successful, you need two people working. So all of this causes a lot of stress, and this stress can add it up in your life left and right. So we're going to look at the scalp massage. Everybody know, when you undergo a massage, what happens? You feel definitely better. Is there any studies kind of help and see what happens to the massage and all that? The authors looked at the research and they looked at the previous studies scalp massage had done. They looked at the people who have knee problem, and they found this a beneficial effect. So they wanted to look in this study, the hypothesis we call, does scalp massage help us in our metrics like blood pressure, heart rate, and all those kind of things? Does it help? Okay, so that's the main study. So what did they do? They do the study, they put them two cohort of 34 patients, maybe a little bit small, got all females 20 to 40 now. They were all working in the office. They put two groups, actually three groups are there. One is 11 subject, the other one is also 11 subject, and a control group 12. So pretty much balanced it out, right? The first group, they gave 15 minutes of scalp massage. In the second group, they got 25 minutes of massage. And the other group, they did not do, and then do some, they worked this people up for for a total of 20 times over 10 weeks. Remember that 10 week they followed up. Okay, so initially they collected the blood before, collected the blood after, and see what are the hormones kind of responsible to make our blood pressure, stress level, and kind of goes up. Okay, so let's look at what are the what are the findings on the study. Okay, so what did they I think in this study we can also look at how did they do the statistical analysis to make sure they use SPSS version, good software. It's a small study, so not a randomized control study and all of that. So the biostatistics anybody can do, simple studies like ANOVA, because you got three groups is one way to remember. And you do ANOVA, there is three groups are involved. Let's look at the results, my friend. Influence of stress hormone. So when you define the stress, everything to be measured, they define the stress as the hormone. You got the epinephrine, norepinephrine, and the cortisol. Those are the three drugs they looked, the three hormones they looked at it. Okay, so when you define the stress, they looked at this hormone, and what did they find in epinephrine? You look at the control group was 263, and then if you look at it, 254, and it has come down in the epinephrine. Look at 254 to 212. Norepinephrine came down from 655 to 450, and then your cortisol level, my friend, 23.9 came down to 16.3. Very significant. All of them are statistically significant difference. So based on this, you can clearly say stress hormones, epinephrine, norepinephrine, cortisol level goes down in the in the people who have scalp massage for like 10 minutes. Or 20 minutes actually, 10 to 20 minutes. Now let's look at the blood pressure. You look at the systolic blood pressure. In the control, 147, and in the experiment group 1, it was 139. Systolic blood pressure, diastolic came down from 98 to 89, and the heart rate came down 80 to 73. Normal heart rate is 72. So all of them very, very significant results in the group. You can look at the pre-massage in the both groups. From the experiment in the first group, they did only 10 minutes. I think 157.6 came down to 139, 99 to 89, 80 to 73. All of these parameters, my friend, has come down. Okay, so in the discussion, how does the scalp massage work? I mean, every time what happens when our stress level goes up, sympathetic shoots up. That shoot up, all these hormones kind of go crazy, epinephrine, norepinephrine, and cortisol and all that, right? So what do we, hypothalamus is involved in the secretion of cortisol. So you do like some scalp massage and then relaxation effect, stimulation, and kind of you got this parasympathetic activity. It comes in. What is the parasympathetic? They act against the sympathetic, right? So it decreases all these hormones, especially the cortisol, norepinephrine, and epinephrine. Significant difference after especially the blood pressure, systolic, diastolic, and the heart rate, all of this. And they also looked at the hormone. It has come down. Okay. Now, when you look at the results on this, this is probably, we talked about the scalp massage and then relaxation. What happened? The parasympathetic also, it'll relax the blood vessels. Every time blood vessel constrict, right, you can, you have the positive effect on the, because it relaxes the blood vessels and your blood pressure can go down. So 4 weeks of massage significantly decreases the strain and the blood pressure. Now, what are the limitations of the study? Anytime you look at the study, small sample size, you have to be kind of worried. Short study duration, only 10 minutes. We don't know. There's no long-term follow-up. How many people can afford to have unless, somebody, go and pay for all this kind of things called massage, okay? Now, let's look at the strength of the study. What are the strengths? Randomization, one, they did some randomization. Multiple they looked at. I think the main strength is they could have gone just say like blood pressure. They could have looked at the heart rate, but they did that. They also went after the hormones, right? You take a lot of money to do the measurement. So congratulations to the author. Look at the stress hormone, norepinephrine, epinephrine, and what? Cortisol level they checked it, my friends. Okay, so kudos to my authors on this. Did a great job. So next time, if you think about massage, and if you have like a little bit on the side, or even if you have blood pressure, have a massage. You can always ask your partner, hey, can you massage my hair, or teach them. That probably, who wants to pay like every day? It's not practical. So what I would like to do, based on this research study, there is benefit scalp massage in helping people to decrease the stress level. Eventually, overall, the life is going to be much better. So, my friends, drinking Corella juice for the health, I recommend everyone at least try scalp massage. It's nothing to, what is it? It's not going to hurt you anything, right? You don't have nothing to lose. So, live a happy, healthy life. Enjoy. God bless.